What are things that parents should say, and what are things they should steer clear of saying to their children if they are trying to build resilience?
Okay. There's something called the four most powerful questions. So one of the things we teach everybody is you can't motivate anybody. Nobody can. But you can set the stage. So the four questions are, what do you really want? Once you figure that out, okay, so what are you doing to get there? So when a teenager is doing something they shouldn't be doing, you can go the direct route, which is sometimes appropriate. Or sometimes you can say, what do you really want? Well, I want you to get off my back. Okay. What are you doing? Well, I'm breaking every rule I possibly can, as often as I can. How's that working for you? You're on my back more than ever. What's your plan? Well, I'm going to keep going until you buckle under, and I win. Now, they're going to say it in different words. Mm-hmm. But the punchline is to say, well, what you really want is me to get off your back, and what you're doing isn't working, and you're going to do more of it.
Might not be the best strategy.
Might not be the best strategy, but you're not telling the kid to do anything. You're saying that's what you want? Okay.
Help me help you.
Yeah, I'll get off your back, but not with what you're doing.
So what do you want?
What do you want? What are you doing? How's that working? And what's your plan?
Simple questions.
Simple questions. Now that's kind of in the moment, The kid's, breaking curfew every night. So when you're asking a kid those four questions about the future, the question becomes, what are you interested in? Not what do you want to do, because they have no idea. But what are you interested in?
And what do you do if what they respond with as what they're interested in doesn't really align with your plan as a parent? The child is born, they're going to be a doctor or a lawyer or any one of these things. What if they don't want to do any of that?
Change your plan. The hard thing to accept about being a parent is it's their life. Now, if they say, I want to be a drug dealer, that's not cool. But, a lot of the careers that in our generation, in my generation, families aspired to have somebody become the first physician, the first attorney. And if you couldn't get a real job, you could be a psychologist, right? Those were the rank order. That's just a different place in space. Unfortunately, if you talk to many physicians, physician burnout is at an all-time high. They're not feeling fulfilled in many cases. And the other thing is, unless mom and dad are physicians, mom or dad, or somebody else in the family, mom and dad have no idea what it's like to be a physician. We've got this image, right? And the kids have no idea. And if your child says, I want to be an auto mechanic, well, you know what? Auto mechanics can't be exported. Physicians are going to be exported. Radiologists are already exported to India in terms of the jobs. So maybe we take them to the local dealer and say, can my kid watch for a day? Can we shadow? We have to be more open to a fulfilling life. We really want a child to be happy is really what it's about. And we've just got some well-intended but not really good ideas about what happiness means.